Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Welcome to Axxess's demo of our PDGM solutions. Today's demo will showcase the power of the solutions we've built into our software. We thought long and hard about the daily operations of your agency under the new reimbursement model, and we've included those details in the solution. Our clients tell us they are confident going into PDGM because we have them covered. Let us show you how you can comfortably transition to the new payment model while you grow your business, improve your compliance and patient outcomes, streamline your operations, and increase your operating margins. Today's demo is going to provide you a summary of the power of Axxess. You can also sign up for deeper dive demos for revenue cycle management, clinical operations, agency setup, or Axxess Care at your request. So let's start with what sets Axxess apart. Our first differentiator I'd like to talk about today is the fact that we are an exclusive network service vendor. We understand that revenue cycle management starts at intake, and for that reason, Axxess has built in concurrent billing. With the wrap payment being reduced to 20% under PDGM, we know how important cash flow is to all organizations. With our direct network service vendor connection, not only can you see if a patient is institutional or community at intake, which is going to help you better plan your resources, but you can also experience faster claims processing, up to 72 hours faster. Our clients can expect to see full payment for 30-day billing periods at day 35 if they follow best practice guidelines. Our second differentiator is our cloud-based reliability. We're particularly proud of the fact that we had 100% uptime in 2019. Now, a lot of solutions out there may say they had 99% uptime, and that may sound really good, except when you think about it, that means that you had 4 days of downtime, and when you're providing healthcare in the home, we all know that's just not good enough. With PDGM, this ensures that your field staff are their most productive, and they also experience greater employee satisfaction. We also pride ourselves on the fact that we provide instant software updates. There's nothing for you to download. This helps to streamline your operations and ensure compliance with all regulatory changes, which protects your revenue from possible takebacks through ADRs or any other government audits. Our third differentiator is our single sign-on, which we'll demonstrate shortly. This greatly improves the productivity of your field staff. Other solutions on the market may take you to more than a dozen logins once you get into their system. With one single sign-on, we'll save you time, which will also save you money. Our fourth differentiator is our mobile capability. This enables complete documentation on any mobile device. We like to call it BYOD, or bring your own device. We also offer offline syncing. This is particularly helpful in rural markets. You're instantly notified of late visits, and that will ensure that your organization doesn't receive a down code in reimbursement for an avoidable LUPA. With LUPAs possible in both 30-day billing periods, this can prevent a loss of up to $2,200 per episode. Our fifth differentiator is our clinical intelligence. It's built into every one of our solutions that are all built here in-house. This is basically like a nurse sitting on your shoulder, helping your clinician teams navigate through the regulatory world of home health. You have system-wide workflow automation, which includes skip patterns and clinical logic, and these features have been integrated throughout to streamline your agency's operations during and after the transition to PDGM. The sixth differentiator that I'm particularly proud to talk about is our CAPS solution. Axxess is a CMS-approved CAPS vendor, and our platform allows you to see quality as well as patient satisfaction scores of not only your agency, but also competitor home health agencies. In addition to helping organizations diversify their business, Axxess provides hospital compare scores. What better way to build PDGM specialty programs than by partnering with hospitals who have specific patient care challenges? Additionally, you can improve your patient mix and thus your revenue reimbursement by increasing your institutional referrals through new partnerships with hospitals. Our seventh differentiator is our business intelligence analytics tool. We provide you with total access to your data, and we offer multiple pre-built dashboards. We're going to showcase our PDGM dashboard for you today, and all dashboards can be customized to meet the unique needs of your home health organization. Our eighth differentiator is Axxess Care. We have solved the home health nursing challenge. through our scheduling and staffing solution known as Axxess Care. This allows for an instant connection with qualified clinical staff through an Uber-type experience. You've probably taken an Uber or maybe a Lyft at some point. Axxess Care is very similar. Axxess Care is the platform that connects home health agencies who need to get visits filled with home health clinicians who want to make extra money by completing those visits. We match multiple criteria to include geolocation, a clinician's skills and competency, and also their preferred payment requirements. The benefits of Axxess Care: we've seen our clients grow their revenue because they're able to cultivate referral sources either in new service lines or in new geographic areas. This also helps solve the PDGM therapy challenges by using supplemental staffing to drive down the cost of therapy visits, and at the same time, they're able to control therapy utilization, which is no longer a payment incentive under PDGM. Our ninth differentiator is our client experience. Axxess has trained staff who are industry experts in PDGM who can ensure that you are implemented and supported so that we build a lasting partnership. Our client experience team has the answers to the daily PDGM operational questions, and we continually receive ongoing training on PDGM. Our 10th differentiator is really what makes us stand apart, and that's our culture. We're known for our collaborative and innovative environment. We have a culture of industry and community partnership. Industry in terms of state associations, as well as NOC and NHPCO. We provide thought leadership across the board thanks to our in-house team. Also, we're 100% privately held. This allows for quick responses to industry demands. Axxess led the way for PDGM and was the first software partner to be fully prepared for PDGM. In addition, we give back to the industry through multiple free webinars and PDGM resources, and we'll take a look at those later today. Next, I'd like to show you just a quick look at our BI analytics. We partner with you, as I mentioned, to provide all your data and insights to help you make smart business decisions. These executive dashboards and analytics can be tailored to meet your company's specific requirements. We use Tableau to connect data points, and what you see here is a roll-up of about 80 agencies across our clientele to represent the span of what we are capable of providing you in these dashboards. Today we're looking at our PDGM specific dashboard, but we have many others and for all service lines for home health, home care, and hospice. We can add budget to show you a run rate to budget. You can slice and dice this data any way you choose, either month over month, week by week, or day by day. You can also drop down and show an organization's overview, perhaps by state, region, or even drill down to the branch level. Additionally, we can drop this information by specialty program or by division, depending on your organization's preference. For purposes of the demo, blue represents a positive trend and red represents a negative trend as defined by the agency. We've divided this by early and late and community and institutional, so this allows organizations to have an insight into their revenue to grow those higher institutional referrals as per an agency growth strategy. For institutional, we know early is the category that provides the highest reimbursement, whereas community late provides the lowest. From a financials perspective, we've filtered for the 12 clinical groupings under PDGM. Now, this can also be filtered by branch or by region. We think it's important to understand which clinical bucket your revenue is falling into. This gives you insight into potential business development and also can help you code more effectively to maximize your revenue. This includes your direct care costs, which includes cost of your staff, mileage, and supplies. It does not include indirect costs such as administrative salary, rent, marketing, and subscription and licensing fees. Notice we break this down by payer source because we understand with PDGM, agencies are looking to diversify and obtain multiple payer sources. At this time, Medicare is the only payer source showing PDGM. However, we know multiple Advantage plans and VA have all announced they will follow PDGM, and we want to be ready to capture this information. For visits per episode, as important as top-line revenue is, so is the cost of your service, and this is a quick way to track whether you are over or underutilizing your visits. Average revenue per episode, we look at both first 30 days as well as second 30 days, and this allows an agency like yours to manage resources associated with lower revenue, which typically occurs in the second 30-day billing period. LUPAs. Everyone's been talking about them, and we're keeping track of them. There are 432 LUPAs with PDGM in each of the first 30 days and second 30 days within an episode. Our software will identify where the LUPA threshold is on admission to help you plan for this in advance. This will help you protect your revenue. As you may know, each LUPA can cost you $1,100 in revenue loss. By understanding how to staff in order to prevent those, and by capitalizing on Axxess Care, we can help you protect your revenue. Your patient to clinician ratio. This is very important to monitor your full-time cost of staff under PDGM. If it's too low, you're ending up paying double for your staff, and if it's too high, then you risk staff burnout and turnover. You probably know the cost to replace a registered nurse in home health can be up to $50,000 according to a workforce study recently completed in the state of Texas. This is why Axxess Care is so crucial to help you pick up extra visits and help keep this number in line without adding additional full-time employees. For discharge and non-admits, often staff will load balance when productivity seems to be too high. So therefore, Axxess Care really is a tremendous tool to help that load balancing diminish. When it comes to days to bill wraps, as I mentioned before, Axxess is an exclusive network service vendor, meaning we provide you with a direct connection to CMS. We can bill faster and get you paid faster. Additionally, our system is set up to provide auto billing for wraps and for finals, and we also offer a built-in physicians portal. Days for wraps. Now, we try to benchmark 7 days or less. With the billing changes that are already here, having a partner who can provide you that peace of mind is vital. Days to bill final. Again, agencies want to keep a close eye on this for cash flow purposes. Our goal is for finals to drop by the 5th day after the billing period. Let's take a look at CAPS. Before we log into our home health solution, I want to briefly show you how CAPS does more than simply give you insights on patient satisfaction. It's really a tool for success under PDGM. So when you'll log into CAPS, you'll land here at this agency dashboard. This provides a high-level view of your survey progress, the impact on quality measures and patient survey star ratings, as well as your home health compare scores for patient quality and outcomes. This also allows you to benchmark against your competitors, and we also offer additional market opportunities that I spoke about earlier. So with one simple click, you'll be taken to a page that has details about your competitors' info. So you can take a look at home health organizations in your same area and see how you stack up because you're all getting publicly available data. What I'm particularly excited about within the CAPS platform is the marketing opportunities. With one other simple click, you'll be taken to another page that has those details. Considering the impact that referral sources have on reimbursement under PDGM, we've embedded CMS hospital readmission data for all your local markets. When you're looking at your hospital readmission rate, you're able to hand this data to your marketer and you can provide this for them so that they can go specifically to a physician or a hospital that may have a particular need to prevent readmissions when you have a program that may help them combat that. It's important to note that we use mixed mode method for our surveys, which ensures that you have the best possible response rate to increase your star rating. Our oral and written surveys are offered in multiple languages, which ensures that your patients understand the questions. And these important ratings allow you to contract with referral sources for preferred provider status, thus improving your revenue under PDGM by increasing your institutional referrals. Now we're going to take a look at our home health software. As I mentioned before, you have one single login, so when you log into the Axxess platform, over on the left-hand side, you'll see all of the software solutions that you would have access to, so you can see our entire suite there. Many software vendors on the market may ask you to log into each individual product that they offer, and in many cases, you might have as many as 15 logins or more. Axxess's single sign-on functionality streamlines your operations. So I want to highlight a couple of things on this page for you. Number one, in the bottom center, your past due visits. This is a great tool to help you prevent avoidable LUPAs under PDGM. Over on the right, you've got your Alert Center. That's your single source for documentation correction. With PDGM, every single visit has to stand alone as billable, so you're able to fix any corrections and the alerts will go right there so that your clinicians know exactly what they need to tackle before they go out and do their visits for the day. In the center of the screen, you see the map. This quickly allows staff to plan visits in geolocation. That's going to improve your productivity and it's also going to decrease your mileage cost. So let's log into our home health solution. All of our solutions are permission-based. We're viewing this as an administrator with all permission levels, so any data that can be viewed will be available to us in this demo today. When you log in to our home health solution, you come here to your Axxess Planner. So the first thing I want to highlight is My Scheduled Tasks. The good news is it looks like it's going to be a light day for you, but any upcoming visits you would be assigned to, you'll see right there. And in a moment, we can take a look at our Google integration so you can understand how easy it is to plan routes for your visits. We know cost-effective care is a must under PDGM, and by using geomapping to schedule visits, we're helping agencies ensure the productivity of their field staff. Let's open with our PDGM Center. The PDGM Center is an easy place to access multiple PDGM tools. We're going to begin by looking at our agency-level dashboard. All of this data can be drilled down to the patient level. This dashboard is similar to what we saw in the business analytics tool, but at an individual provider level. This is an excellent way for administrators to track data in real time and improve the health of their agency in light of PDGM. Our LUPA risk will show all patients on census with visits scheduled. Low risk will show those patients that have visits scheduled that are above the LUPA threshold, so therefore they're a low risk. If they're a high risk for LUPA, that's specifically for those patients that are equal to the LUPA threshold. LUPA is for those patients that have visits scheduled less than the LUPA threshold. The average length of stay is useful to track for agencies so that they can help forecast the potential medical necessity. Your upcoming 30-day review is a great operational tool for multiple reasons, specifically to include change in focus. Gross margin for first and second 30-day periods is a great tool for comparison to budget and also a great way to maximize visit utilization. Even with decreased reimbursement for the second 30-day period under PDGM, it is still very doable to earn healthy gross margins if you implement cost-effective resources and staffing. The average revenue per billing period will list the top 5 clinical groupings for the agency, along with the amount of revenue for each of those groupings. This is very useful to operations and to sales to track new specialty programs. It's also a great litmus test for coding as well. In addition to the revenue, we list all clinical groupings with the number of patients who are in that particular grouping. The next 3 PDGM criteria are listed at both the start of care and at the recert. I find the functional status comparison especially helpful for tracking OASIS reliability. If these scores go up at recert, we may have an issue with patients meeting their goals. Improvements in scores are expected at recert because patients are progressing toward those goals. This could impact your revenue as functional level could move from a high to a medium or even down to a low. The estimated margin per billing period and clinical grouper is a great tool to track the profitability of each of the 12 clinical indicators. Total visit and supply cost are subtracted for incoming revenue. It is very possible to receive higher margin in the second 30-day period, even with lower revenue, as those visits are tapered down because they may have been front-loaded in the first 30 days of the episode. The average visits per episode is a great way for an organization to see at a glance overutilization of visits and underutilization of visits and compare that to the national and state averages. By tweaking visits, agencies can quickly improve their gross margin. Next, let's take a look at the billing center. As we mentioned, we have concurrent and auto billing of both wraps and finals. So what that means is if you meet the criteria to bill under Medicare and you set up auto billing in your agency and set up the bills that will auto-generate and bill through our direct connection. As you see here for wraps, once the OASIS is submitted and the first billable visit is performed and verified, you would see 3 green checks. Now right there you see 3 red X's, so those aren't ready to bill. If they were, you would see those 3 green checks. That would indicate that the wrap would be processed for billing. You can also quickly check the status of all claims here with the click of one simple button. Final claims work in the exact same way, except that there would be 4 green check marks. With our physicians portal and integration with Worldview, we ensure that your orders are received timely so that final claims process quickly. With 80% of your revenue processing on that final claim, we know how important this is to you under PDGM. With the PDGM modeling tool, we'll take a look at that next. This interactive tool was put in our solution last year to help organizations prepare for the impact of PDGM. This is a learning tool, and it helps organizations understand how revenue is constructed under PDGM. In addition, I want to highlight the fact that this tool is available at intake and will allow agencies to enter information for reimbursement. The tool will calculate the revenue and allow your organization to allocate resources and plan for visit utilization. Our PDGM Resource Center provides excellent resources for your staff as well as recorded webinars. My favorite tool is the top questionable encounter codes. Those can be used with physicians as well as an educational tool to prevent those referrals coming in with questionable encounter codes. Our PDGM Revenue Impact Analysis, our PDGM projection tool. Now that PDGM is here, agencies are using this to assess the health of their operations under PDGM. I want to tell you a quick story. Last year, we had an agency owner who used this tool early in the year to show her future PDGM revenue, and she got scared. She called one of our product managers because her numbers showed a significant loss for 2020. She was ready to close her agency. But our product manager said, wait a minute, let's take a look at these tools, and I want you to do some research and run the numbers. She showed her the tools within our PDGM center, and she could turn around those numbers based on the tools we built in the software for her. We kept in touch, and she called us back 5 months later and said not only was she not going to sell her agency, in fact, she was even growing her business. She had turned a 35% loss into a 40% improvement in revenue over PPS. She was showing green in all areas, and best news, she was showing the best profit revenue that she had in more than 7 years. That's why Axxess truly is the partner of choice. We've built in tools for you to help grow your organization. I want to show you our report center before we get into the evolution of a patient. We have a really robust report center, but a few that I want to highlight for you from a PDGM perspective. Our 1/X report is very similar to a 1/60 report that many of us have used under PPS. This report will show PDGM revenue based on a 30-day billing cycle, and it's an excellent report to use for month-end close as well. Our LUPA report will quickly show all patients that had a LUPA down code and the amount of that revenue adjustment. This report is good for helping to determine the percentage of avoidable LUPAs so that you can put corrective actions in place quickly and turn that around so that you can protect your revenue. As part of a release within our PDGM report category, that will be added, and we'll have other PDGM specific reports included in the near future. One thing I want to highlight within our software solution is our ease of use. Everything that's entered at intake flows to your start of care, and that's going to help streamline operations for your clinical staff. Within our intake process, we offer a single-click check for PACOS verification. This allows you to quickly make decisions for your non-PACOS verified physicians. During intake, you can begin to track face-to-face to make sure that you're able to quickly bill those new 30-day payment cycles under PDGM, and of course, this also will ensure COP compliance. I talked earlier about the geomapping capability. We have an integration with Google, so not only can you verify patient addresses so that you can provide turn-by-turn directions to your staff, which increases productivity and decreases their windshield time, but this also ensures your electronic visit verification compliance as well. We verify your Medicare eligibility on the 1st and the 16th of the month, and also on demand due to any changes in payer sources. This is an excellent tool for PDGM because it lets you determine if a patient is an institutional referral if that acute facility has filed the claim for that patient. For a primary diagnosis, I want you to note if I enter a diagnosis that is not going to create a grouper under PDGM, which means you wouldn't get reimbursed by Medicare for that diagnosis, we get a hard warning and a stop. This is going to allow the agency to contact the physician and obtain a code that can be used to create a grouper. So let's take a look at our patient charts, and today we're going to spend a bit of time with Tammy Arnold. You're going to see valuable reports on the right side of her chart, and we'll take a quick look at her episode summary to kick things off. As best practice, many agencies are now holding team conferences or providing care coordination with all disciplines every 30 days rather than every 60 days. The primary reason to do this is to determine if there is a change of condition from the first 30 days to the second 30 days. And with PDGM, the primary focus of care drives the reimbursement significantly, as we all know. This form is also very useful for physicians who bill care plan oversight or CPO every month. If they perform 30 minutes of oversight a month for a home health patient, they can bill for that service at a rate of at least $100 per patient. Sending this to the physician for overview not only improves the care coordination and updates the physicians on progress toward goals, but it also allows the physician to track their billable time because they've reviewed the documentation. The next thing I want to highlight is the change in focus form. This is perhaps the operational solution in the industry for PDGM. If after review of the 30-day period you need a change in focus, all of the documentation that's needed to support this, to include your medical necessity, is available with one click at the patient chart. This form allows a change in the primary diagnosis and secondary diagnosis and provides a space for the narrative to support the change in focus. This also protects your revenue from future probes and takebacks. Once it's completed, the new case mix can be calculated directly from this form. Additionally, the new diagnosis will also flow directly to the billing claim form as well. If we take a look at the top of the form, you'll also see quick links to the major categories that may need to be updated that are associated with that change of focus, to include a DNR, a fall risk, a hospital risk, and an infection risk as well. Let's look briefly at the OASIS and the comprehensive assessment. You'll see that the OASIS and the plan of care are fully integrated. So when we talk about ease of use and streamlining operations, this is exactly how that happens. The areas in green, like you see there, demographics, automatically flow to the plan of care, and changes that are made to the OASIS automatically change on the plan of care to improve the productivity of your field staff. Let's take a look at our cardiac status on the left. I want to highlight this for you because we here have your customizable templates. This allows for flexibility for your specialty programs. You have an unlimited number of templates, and within each of those templates, you can fill it with up to 5,000 characters. So you have plenty of space to create these templates, which will help grow your business through specialty programs, shared risk models, and other specific needs for referral sources as agencies work to diversify their business under PDGM to ensure greater profitability. As you probably know, medical necessity is the #1 survey deficiency. We ensure that all major sections include this, as well as homebound, to improve compliance and provide justification for your intermediaries to protect your revenue. This is really important with PDGM, as every single visit has to stand alone, and a down code of even one visit could result in a LUPA down code. I want to highlight next our functional abilities and goals. Here, we provide tooltips to provide guidance while documenting. This is going to improve your patient outcomes due to a thorough understanding of the documentation. We know that functional scoring is a big part of reimbursement under PDGM, so here we're providing your staff extra guidance on how to assess and document this information. Additionally, we're offering built-in training videos to enhance your clinical team's knowledge of the care that they provide. This also helps them maximize the use of our software as well. I've talked about ease of use several times, and you can really see that. We also prioritize compliance. Home Health Gold will scrub the OASIS at the end of the assessment, and our real-time validation will not allow your clinical staff to answer questions that aren't logical based on diagnoses and other OASIS items. For example, if a clinician documents dyspnea in a patient's respiratory assessment, they won't be allowed to document that a patient isn't short of breath when walking more than 20 feet on M1400. This is going to prevent multiple corrections at the end of the OASIS and teaches nurses as they go along how to answer those questions correctly. It will also greatly improve the accuracy of the quality scores as well as functional scores for patients, and as we all know, that's all tied to reimbursement. Note that the need for therapy and HHA can be addressed directly from the OASIS and the start of care. The AID care plan can also be developed from this site to improve productivity. We offer multiple forms like your plan of care, your assessment, and your HHA care plan. Additionally, the medication record is also created from a single assessment. So again, we streamline your operations because you don't have to go to multiple places to document your information. Another PDGM success tool is the integration of the therapy plan of care with the comprehensive plan of care. When this is completed within 5 days, this will decrease the volume of orders that a physician must sign, and this will also speed up your billing process. One document and everything is all in one place. Therapy can see the nurse's OASIS questions, which facilitates collaboration on the OASIS for more accurate scoring. Through this collaboration, agencies are seeing huge improvements in their functional scoring and even increases in their revenue because therapists tend to score patients more objectively. They want patients to show them, and they assess based on that as opposed to just telling them. The final rule now allows for PTAs to perform therapy maintenance visits under a maintenance therapy program. Many organizations are starting PT maintenance programs as a way to help control their therapy cost. Axxess has you covered with therapy goals and interventions and statements of medical necessity. We've had maintenance visits listed as a visit type in the Schedule Center to alert agencies that the visit planned is focused on maintaining function and not working to restore it. Our summary of care checks many compliance boxes for your organization to include patient-stated goals, care coordination, plan of care review, and skilled interventions. In addition, it allows you to quickly enter your visit frequency, which will make your scheduling seamless. Lastly, our OASIS Scrubber. This helps you to provide easy corrections and gets you maximum reimbursement. Over time, this will help teach your clinicians better documentation. From a revenue planning perspective, that revenue is highlighted if the permissions are granted. Now note, everything available here is also available on mobile, including those handy sticky notes that alert field staff to key issues. The next thing that I want to highlight for you as these windows are continuing to pop up, you see there that the revenue doesn't show up because we have an error, something that we need to correct before that would be completed. The next thing I want to highlight for you isn't really within the software, it's underneath it. I want you to take a look at the windows that we have open. You can have up to 8 open windows at one time. Again, that will help streamline your operations incredibly because you can very easily navigate from one window to the next as opposed to having to back through window by window. Let's take a look at our plan of care. We're going to open up our print plan of care, and I want to show you a couple of particular features and highlight those for you. As discussed, when going through your start of care, you're going to notice in the plan of care as well, your emergency preparedness is clearly and easily documented, as well as the advanced directives and patient involvement in their stated goals. The therapy plan of care has been fully integrated, and your medical necessity and homebound is also highlighted. This is built in to justify comorbidity and help you protect your revenue with PDGM. Our Schedule Center is the next thing that I'd like to highlight for you. We color code all of the visits by visit status, and our scheduling is orders driven to prevent visits outside of those orders. Very soon, our clients will see a 30-day view of the calendar with warnings if the agency has scheduled a LUPA visit for either the first or the second 30-day period within the episode. You'll also get warnings for visits that happen to be out of frequency or out of authorization, and you can also include hard stops. One thing I want to highlight for you are the sticky notes. Red sticky notes are items that are returned from QA. A yellow sticky note is specific to that individual visit. And if you have a blue sticky note, that relates to the entire episode. Perhaps it's a gate code to get into the home. The next thing I'd like to show you is Axxess Care. As an internal scheduling solution, you can broadcast visits that need coverage. For example, a nurse happens to call in sick or maybe out on leave for a longer period of time. This helps you to provide easy coverage for weekend shifts or any additional shifts you may get. As a staffing solution, you can post visits externally and tap into a pool of clinicians who are working for agencies that use Axxess software, so those clinicians have a very easy time to transition to those visits. Axxess Care allows you to connect with qualified nurses and therapists because we match multiple criteria to include geolocation, a nurse's skills, their competency, as well as their payment requirements. We talked about growing your referral sources. If you happen to get a referral from outside your normal service area, you can tap into the Axxess Care pool of nurses who can then go complete that visit. You can make sure that that patient receives quality care, and you can therefore nurture that referral source. Axxess Care is essentially a PDGM power tool. This helps you prevent LUPAs because you're addressing those staffing shortages. Next, let's take a look at our QA Center. As a best practice, we recommend QA for your nurses or clinical managers, and this is a single source for those documentation corrections to take place. This improves your compliance because it alerts your staff to complete, add, or edit documentation to comply with your agency standards and the COPs. The gross margin calculator shows your agency's gross profit and loss so that you can adhere to predetermined gross margin percentages and evaluate care and utilization more closely. This assists with financial operations by ensuring the proper steps are taken up front to ensure accountability and communication between financial and clinical operations. The cost per visit is determined by the agency's setup. Most agencies choose to use direct care cost only. As with everything else in the software platform, this is all based on permissions. So your case mix analysis tool will show revenue for both the first and second 30-day periods as well as your LUPA rates. In addition, this provides a number of points for functional scoring. This is an excellent tool for clinical managers to use in their review of OASIS to determine accuracy of scoring. The last thing I'd like to show you is our PDGM Help Center. This is a great resource with all of our PDGM tools that you can reference after this demo. Our PDGM Help Center workflow automation is a tremendous asset for any organization that wants to thrive under this new payment model. Here you'll find screenshots and details to highlight all of the PDGM enhancements that we've built into the software. This is also where you'll learn about how to schedule a change in focus. PDGM is the biggest change in reimbursement in home healthcare in the last 2 decades. If you're prepared with the right partner, the change will be seamless. There are many daily operational impacts with PDGM, including revenue and cash flow adjustments that our tools can help you prepare for. The industry leaders at Axxess can put you on the road to PDGM success. Thank you.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.